To describe the framework that goes along with clinical integration, I would probably tackle that question in two different formats. One is, throughout the years, the lessons that we've learned are that there's three critical components when you're building a framework around clinical integration. The first one is to make sure that you have a care continuum model. In the old days, you could focus on one aspect of the healthcare delivery system, the hospital, the providers, the post-acute world. Now you have to incorporate all elements of that. The second is that you need a framework or a structure within which the the providers, the hospital, healthcare system, and supporting staff can all come together. The third component is you need a structure that allows for data and free transparency of the data so that you can judge how your clinical outcomes are. We've proceeded in a journey that started with a pharmacy and therapeutics committee in the beginning. We extended it to a clinical programs committee that oversaw all of the clinical practices for the system, and subsequently have evolved to a clinically integrated network and an accountable care organization. In order for organizations to develop a clinical decision-making structure to support clinical integration, there's a couple aspects that are key. The first is there's two tenets that I've come to firmly believe are really important. First is establishing a governance structure. The second is making sure that there's accountability and escalation loops as part of it. We really have learned throughout the years that what existed as traditional silos really need to be brought together in one structure. These three elements are quality and patient safety, two is clinical practice development, and the third is clinical variation reduction. There are several ways for clinicians to contribute to organizational cost savings. I'm going to describe this in two different formats, a macro level and a micro level. On the macro level, we need clinicians and physicians in particular to be thought leaders. We need ideas to be generated and folks to question the way things should be done correctly. The second way is that we need the physicians and the clinicians to feel comfortable with challenging the status quo with data and transparency that goes along with it. On the micro level, I think we really need, in order to be successful, we need physicians to be embracing team-based healthcare. It's a paradigm shift from the traditional model where the physicians were the captain of the ship and they were in charge of all of the aspects of healthcare delivery. Now it's really about the healthcare team.